I recently made a video about neck pain and scoliosis, but I got a comment. Someone was asking me about shoulder impingement, and I replied explaining that similar to the way neck pain might come from the mid-back, a shoulder impingement might be caused by a scoliosis, but it also might come from another area in the body. And today I'm going to show you how to work out where your shoulder pain is coming from, because it might be coming from somewhere as far away as your ankles. Yep, that's a thing. Now, for those of you who don't know me, I'm Ed Paget. I'm an osteopath, and I specialize in helping people with scoliosis and teaching other professionals to do the same. But before we start, I need to give you a real quick overview of the anatomy. Okay, the shoulder consists of three bones: the humerus, the scapula, who likes to be called the shoulder blade, and the clavicle, which has the street name collarbone. The most common cause of impingement is when we lift our arms up over our heads and the muscle that goes over the top of the humerus gets pinched in the tiny space that it has there. Now, doctors and physios love to call this the supraspinatus impingement syndrome, because that's the name of the muscle that goes through there. And some might even suggest a surgery to open up that space and make more room for the muscle. Now, this makes sense if there is a bone that's grown into that narrow space, and that's where the impingement is coming from, but most likely it's coming from somewhere else in your body, and it's probably because it's not moving properly. Okay, I'm going to show you 4 ways that other areas in your body can affect your shoulder. All right, so we talked about how this bone here, the humerus, has to go up and over, and the scapula has to move, and it has to move sort of 1 degree to every 2 degrees of the humerus. Well, what can stop that happening? Well, let's have a look at this. If I take my hand up over here, I really want my hips to shift a little bit to the side. So do this at home. Stand with your hips still, take your shoulder up and over, and feel tightness or discomfort, whatever you feel in your shoulder. Then move your hips. And you might notice that when you move your hips, it becomes a whole lot easier. So the first thing we need to look at is, does your hip, this hip here, move to the outside? If it doesn't, well, we might want to do a stretch or something on the outside of the hip. But it could be this hip. Does this hip actually slide across? If it doesn't, we might want to stretch this hip. So there's the first 2 movements. Secondly, we want to think about how the hips move forwards and backwards in space here. Because if I'm flexed forwards, I'm going to be pulling my shoulders forwards, and trying to get my arm up over my head is going to be very difficult. And if I keep trying, I'm going to jam up that subacromial space and cause the impingement. So I want my hip to be able to move freely. So if you have a shoulder impingement right now, I want you to try this. Let's take one leg forward, step, push your hips forward. Just see if you can get a stretch at the front of your hip. Swing the arm forwards and backwards as you get that stretch, and then just slowly, slowly see if you can bring it up higher and higher. And maybe you'll be able to go further up than you did previously with just going straight forward, because we've engaged the hips. Lastly, we want to think about how the hips move in rotation, left and right, because if they don't move, then the shoulder is going to have to do more work. Over time, that's going to tighten up muscles in the shoulder and not allow it to travel up over your head as well and cause an impingement. So imagine I'm playing pickleball, which I like to do, by the way, and I just use my paddle left and right like this. Well, I really want to move my hips, much like tennis, and I want to be able to use them to push the ball forward. Or if I do a backhand, I want to use the hips to load and explode. If I don't, then the shoulder is going to take the brunt of it. Now, if my hips are tight, what can I do there? Well, I can just simply move my hips in a really nice figure 8 circle and start to work the motion through there. Get some motion to your hips, play some better pickleball, take the pressure off your shoulder. All right, so that's how the shoulder can be affected from your hips. Next, we want to solve the mystery of how can the shoulder be affected from your ankles. Well, there's a sport called CrossFit, and in CrossFit, they actually take the bar up over their heads when they go to the gym. Same with powerlifting and all that kind of stuff. So I'm not going to use a bar, but I'm going to use this dowel here. What they do is they put the bar up over their heads, and then they squat down, trying to hold the bar up over their heads. Now, if you've got a tight ankle, and this happened to a client of mine, his right ankle was tight. He was trying to squat down, but if you imagine, I'm just going to hold my right ankle tight. If you imagine my right ankle doesn't move, and I get to this position, what happens is my left shoulder comes forwards. Now, if I've got heavy weights on that left shoulder, I'm going to pull it back to keep balance, right? And so he ended up hyper extending his left shoulder, trying to keep the bar up over his head. So the solution was to simply work his right ankle to cure his left shoulder impingement. So the same can happen in a very different way for people who have their hands up over their head and maybe walking up and down stairs, or using anything to do with their feet whilst their arm is up. If the ankle isn't working, it can affect the shoulder. So always check the ankles when you have sore shoulders. Hey, I'm just going to jump in here for a second. If you like this video and you want to learn more about what you can do from home to manage your scoliosis, then make sure you like and subscribe to the channel, but also click that notification bell so you get a special little message next time I post a video, and that way you won't miss out on any of this important content. Okay, back to the exercises. Third way, we want to talk about how the opposite arm could be affecting the shoulder. Okay, so we mentioned the scapulars at the back and the collarbones at the front. Well, the collarbones attach at the front here, and that's the only ligament that's holding on the whole arm. So these two bones here, this bone here, scapular at the back, they're all attached by a few little ligaments at the front here where the clavicle is. At the back, they're held on by big muscles. So don't worry, your arm's not going to fall off or anything, but it's just some smaller ligaments at the front. But if those ligaments get tight, or if these muscles that hold onto the clavicle get tight, this arm doesn't move so well. Now, what's that got to do with this arm? Well, when we walk, we actually get a reciprocal motion, okay? So one arm moves forward while the other arm doesn't. And if this arm doesn't do its job, this arm might end up doing more. Over time, this arm is going to get fatigued or overused, or the muscles are going to be unhappy about that. So when we put it into for extreme positions of rotation, of flexion up here and rotation, we're going to get a shoulder impingement because this arm isn't doing its job. It's not allowing the sort of reciprocal motion that happens when one shoulder blade moves forward, the other one moves backwards. So even like reaching up like this, if we move up like this and this shoulder doesn't drop down properly, well, we're not going to get that movement into our back, into our hips and so on, and this arm is going to bear the brunt of it and it's going to feel the pinch. So always check your other shoulder when working or trying to help the impingement in the main shoulder that hurts. Lastly, we want to look at how the spine can affect your shoulder. All right, so with a lot of people as they age, regardless of if you have scoliosis or not, there is an increase in their upper back hump, and we call that a kyphosis. Okay, so computer work, driving, or in my case, leaning over patients and that kind of thing, you end up getting a slightly rounded forward posture. Now, if I'm standing up straight, I can take my arm up over my head 180 degrees, no problem. So 0 degrees here, 90 here, 180 here. But if I'm bent forward, my 180 is actually here. But life might want me to put my arm up over here. Maybe I need to catch a ball, or maybe I'm playing pickleball again. I need to take my arm up over my head. But I can't because my spine doesn't allow me. But if it did, that's the limit of the motion now. If my spine works, I get a huge amount of extra degrees or extra range of motion at the top just by releasing my spine. So if we have a tight upper back, then we need to release that to decrease the shoulder impingement that we might be experiencing. And how do we do that? There are tons of exercises out there on how to mobilize the upper back, so I'm not going to go into details here. If you want to confirm the cause of your shoulder impingement and find out if the scoliosis is making it worse, go to the link in the description and book a free scoliosis assessment with me or one of my team.